One of the nation's top hospitals has been forced to dig into its emergency stockpile of crucial supplies that were designed to last through the worst 2 weeks of this crisis, which have yet to come. As the number of healthcare staffers infected has quadrupled since earlier this week. Joining us now, the president of Massachusetts General Hospital, Dr. Peter Slavin. Dr. Slavin, thank you very much for joining us. First, we'd like to know, we know there's a lot of healthcare workers across Boston, the Boston area, that have tested positive. How do you keep your doctors safe as they are treating patients during this crisis?
Well, yes, we have over 40 of our staff at the hospital that have tested positive. We are trying to provide them with all the protective equipment that we can. Those who are treating patients with COVID or suspected COVID are wearing not only surgical masks, but gowns, face shields, et cetera. And we have issued masks to everybody who's working in any of our clinical buildings to protect them as well. Right now, we think our supplies of masks and other needed equipment is in reasonable shape, but we expect this to be a marathon, not a sprint. And so we worry over the long term as this continues to build, whether those supplies will be there.
If you continue at this rate, where do you suspect you will be in the coming weeks? And also, do your doctors and do your healthcare workers have a place to isolate when they leave the hospital?
Well, we are monitoring our data very carefully, trying to compare it to trends in various cities within Italy to get a sense as to what curve we might be on. And I think it's too soon to know. We certainly have our fingers crossed that we won't be overwhelmed with cases, but only time will tell. I think the psychology of the healthcare workforce is very fragile at the moment. People, on the one hand, are determined, committed, energized to fight this national crisis, but at the same time, they're worried about their own health, the health of their families, their economic futures. And as John Meacham said in the last segment, I think it's really important that we be honest upfront with our workforce, that we hear what's on their mind. We don't dismiss their concerns. We tell them that we are going to be with them every step of the way. We're doing everything we can to get the supplies they need. It would be tragic if they were caring for patients without the necessary equipment. It would be like sending soldiers to battle without helmets or body armor.
Massachusetts has made the decision to graduate all fourth-year med students early and try and step up the capacity of the medical workforce. What are they foreseeing ahead?
Well, if indeed our workforce shrinks because people out due to illness or being quarantined, it would be very helpful to have other healthcare workers come in to replace them. Yes, medical students typically would be graduating in a year and would be in a month and would be eligible for licensing. And so I think our state and our medical schools are very interested in accelerating that by a month so that graduating medical students could be available to help with this unprecedented crisis.
Dr. Slavin, it's Willie Geist. We appreciate you taking some time this morning, and thanks for all the work you and your staff are doing around the coronavirus crisis. It's interesting to hear you say that you have to raid the emergency stockpile at this point, and I think it's probably worth for our viewers to stop and understand how exactly procurement happens normally and how you would get these masks and all this equipment you need, because it would tell us something about how hospitals get these things. We're hearing from the governor pushing the federal government to say we need all this stuff. We got to get it into the hospitals. From where you sit, can you push? Do you have levers? Can you go direct to companies? How do you get that equipment to your hospital faster?
Well, first of all, I think this is a big lesson for the hospital industry in our country. Up until recently, the mantra within hospital procurement of supplies was make the supply chain as efficient and as effective as possible, have just-in-time inventories of supplies. And I think in retrospect, particularly in light of this crisis, that was the wrong approach. We would be in a much better position if we all had large inventories on hand. We are pursuing supplies through a number of different angles. I mean, buying from our existing vendors, trying to identify other vendors, but we're also calling for people across the country to use their innovative skills to develop these supplies in new ways through things like 3D printing, for example. We're also looking at repurposing similar supplies in other industries, like from the construction industry, whose masks are probably useful and suitable for healthcare use. And we're also looking carefully at how we can reuse some of our equipment. We're looking at the use of radiation, ozone, and ultraviolet light as possible ways to re-sterilize our personal protective equipment and reuse it. So we have a team of people that is examining those and other opportunities.
Dr. Slavin, I know Mass General is one of the hospitals doing clinical trials on a drug that has shown some promise with coronavirus patients from a company called Gilead Laboratories. Can you tell us more about that drug and how promising it has been in some of your patients? Because I think a lot of hospitals would be interested to know if it's working where you are, how they could get it themselves.
Yeah, the drug is called remdesivir. It is a RNA polymerase inhibitor, and theoretically, since the virus is heavily dependent on that enzyme to reproduce or replicate its RNA, you would expect it to be effective. It was a drug that was initially developed for Ebola for similar reasons, but in clinical trials, it didn't prove effective in the treatment of Ebola. So there is a clinical trial that Gilead is sponsoring in a number of sites around the country, around the world, to see if it will work for this virus. It seems to be active in the test tube against this virus, but that doesn't necessarily mean that it will be effective in patients. So we don't have a sense at this point as to how patients are doing with it. It's a randomized control trial, so patients are randomized to receive either the drug or a placebo, and I'm hopeful that in the coming months or sooner that Gilead will have some results that will enable it to be used or not used more broadly.
Dr. Slavin, you mentioned John Meacham. He's here with us, and he has a question. John?
Doctor, wondering, you're on the front lines of this in the thick of combat, and looking both at what you're seeing and what you've learned from around the world, do you have any estimate on what you would like to see in terms of a continued social distance lockdown in the way much of the country is at the moment?
Well, first of all, I don't like to refer to it as social distancing. I prefer the term physical distancing. It seems like we need more social connections now than ever before. But I think it's way too soon to be thinking about when we're going to take our foot off that brake. The numbers of cases here in Massachusetts and in most parts of the country continue to go up. And until I think we reach the peak and are some distance past it, we need to do everything we can to try to minimize transmission. That is the strongest weapon we have in our arsenal to lower the curve, lower the peak, and make sure that our healthcare system is not overwhelmed and that fewer people become infected in the long term.
This physical distancing, though, that you're talking about, Dr. Slavin, in New York City, in Boston, in other major congested areas, it's impossible. I mean, you're asking people to stay in their apartments and in their small apartments for long periods of times, but even more, these healthcare workers who are going into your hospital, exposing themselves on a daily basis, they're going home to their families. This is not physical distancing. It's not happening if you look at that reality. Is there any way that can change?
Well, even in congested cities like New York or Boston, I mean, people can stay in their apartments, stay in their homes, do as much takeout, grocery delivery as possible, and only go out when absolutely necessary. And you're right, we do rely on a certain subset of our society, like healthcare workers, to fight this virus in a way that's not necessarily consistent with physical distancing. The healthcare workforce is determined to fight this virus. I think they're, in the vast majority of cases, personally willing to take that risk. And I think we just all need to stand behind them with whatever support we can to make sure that they have all the tools necessary to do the best job possible.
The president of Massachusetts General Hospital, Dr. Peter Slavin, thank you very much for coming on this morning.
Thank you.
And up next, just about everything else, religious services have been disrupted in ways we couldn't even imagine just weeks ago. But for many people, they are needed now more than ever. So we're going to tackle that next with a pair of leading voices making sense of this difficult time for the country.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.